Good afternoon, and thanks for joining us for Living Local, your lifestyle show for all things Charleston and beyond. I'm Ashley Meservey.
Eye on the Lowcountry, sponsored by Dr. Michael Johnson with Retina Consultants of Charleston.
Joining us today, we have Dr. Michael Johnson. He is a retina surgeon with the Retina Consultants of Charleston. Thanks for having us today. It's a beautiful day out here, so I'm excited to learn all about, we're talking about November, which is National Diabetes Awareness Month, correct?
Correct.
But before we get all into that, let's just talk about what you do at the Retina Consultants of Charleston.
Well, we're subspecialists, and we just treat the retina. And diabetes affects the retina profoundly, and it's the leading cause of visual loss in the United States in working age group people between the age of 18 and 65.
Wow. Okay, and I see you have a prop here, and we're going to talk about how diabetes affects the eye, right?
Right. So the way diabetes affects the eyes, it really affects the blood vessels. You can think of it as a vascular disease. So if I open up this eye model and we look in, let me pass that off to you.
I love being a little assistant.
The blood vessels come into the back of the eye. This is the back of the eye. So light comes into the front of the eye through the cornea, through the lens, and it gets focused to the back of the eye, to the retina. This is the retina. This is all we take care of. So the blood vessels come in through the optic nerve, which is the big cable of the eye, and then supply the retina and nourish it. And diabetes really beats up these blood vessels. And what it does is it causes them to leak. So an analogy is you can think of a garden hose, a little pinpricks on the side, and fluid squirts out. That's kind of what happens with diabetes, except the fluid that's squirting out of the blood vessels is not water, it's serum. And serum is very toxic to the substance of the retina. It injures the retinal cells and eventually kills them if it's not treated. So that's the most common way that you lose vision from diabetes.
And a lot of times I think people think with diabetes and stuff, it's, you know, with circulation with their legs and things like that, right?
Correct. It globally affects the blood vessels, but we are so lucky as retina surgeons, we're the only people that can see the blood vessels. So we can tell if the blood vessels in the eye are beat up, so are the blood vessels to the heart, and the liver and the nerves, everywhere else globally, the brain. So it's a wonderful subspecialty. We can tell, sometimes we're the first people that ever diagnose it. The average person is 5 years has diabetes before they know they have it.
So you could be proactive and catch
So we can catch it early and communicate with their family doctor and save them a lot of trouble. The amazing thing is that in South Carolina there's over 500,000 people with diabetes, and greater than 150,000 have no idea that they have diabetes. That's why it's so critical to get in and see your eye doctor. And
know that family history, and that's something we're going to keep reiterating
all
the time. But what would you say are some of the things we should, how would you even know? You go to your doctor, obviously, that's the best way to go about it, but would you have any other way of knowing, like, symptoms?
So a lot of times there are no symptoms, the patient's still seeing fine, and that can go on for years, and then eventually as the disease advances, the patients will get blurry vision, smoky vision, or distorted vision. Like looking through, distortion is kind of like if you go to a carnival and have those crazy mirrors, a hall of mirrors, things look stretched out.
Oh my gosh, I've run into one of those mirrors before. That's a nightmare.
So you don't want to see the world that way.
Do you think sometimes people just think it's because they're getting older?
Yeah, but I think there's just not a great enough awareness that something's brewing in your eye and you have no idea, and the rest of your body as well.
Is it like a ticking time bomb, though?
It is like a ticking time bomb. And let me just show you what can happen. So this is a model of the eye, and we often in the clinic will take specialized pictures where we take a picture through the front of the eye and image the optic nerve and the central retina. So the optic nerve, again, is that big cable that hooks you up to the brain. So let me pass this off to you, and I'll show you what a normal eye looks like and the normal blood vessels. So here's a normal eye. There's the optic nerve, that's the big cable that hooks you up to, and these are the blood vessels, and this is the picture of health. This is what we want all retinas to look like, and it's our job to return retinas to this state. But here's what happens with diabetes. You can see a tremendous difference between these two images. So if I can hold these up, I don't know if you can see that, but here's these blood vessels, they're leaking, and the retina is very swollen. There's yellow deposits, that's the lipid from the serum. And then look how there's bleeding and hemorrhage throughout the eye. So if you don't treat this, this causes blindness. But the great news and the gratifying thing is that we have such amazing technology and really have the world's best healthcare in the United States, so we can treat 90% of patients.
And you are at the cutting edge of all that technology.
Yeah, we have 2 clinical trial centers here in Charleston, which is very unique. So we bring the cutting edge, the stuff that you get at the top universities, we can bring to our local community.
Because
here.
in your area, it really is constantly changing, right?
Yeah, it's a rapidly advancing, and it's so exciting to be a part of it and be on the cusp of the research. But we use medicines, we use laser, and we use surgery to restore vision. And the earlier we detect it, the better the patient will do. But like I say, we can help an astonishing 90% or more of patients.
Okay, so if we're breaking things down really quickly, that type of situation would only happen in here, so we would not be able to see it in our eye.
Yeah, you might not see it for many years.
Okay.
You know it's there.
So
it's a
again,
silence of disease. Also.
Checkups, family history.
See your eye doctor, get regular eye exams, and we can help you in tremendous ways, not only for your eyes, but also your whole body.
Perfect. Alrighty, well, thank you so much for joining us today. And remember, November is National Diabetes Awareness Month, so get those eyes checked. And we appreciate, again, for you hanging out with us today.
Thank you.
Alrighty, more information, you can head online to retinacharleston.com.